Good day to everyone. My name is Sikopo Nyambe, and I am in the Faculty of Health Sciences here at Hokkaido University. And today I'll be talking about findings from our transdisciplinary participatory action research, which examined the water, sanitation, and hygiene ecosystem in peri-urban Lusaka, Zambia. This is the outline of my presentation, and let's get straight into it. So firstly, I would like to introduce you to water, sanitation, and hygiene, also known as WASH. Globally, approximately 2 billion people drink fecal contaminated water, and 4.5 billion use unimproved sanitation systems, risking fecal contamination. Sustainable Development Goal 6, clean water and sanitation, is an effort towards every person having access to clean and safe water by 2030. Studies have shown that improvements in WASH have the capability of reducing global disease burden by 10% through preventing pathogen transmission. This creates a link to SDG 3, which is good health and well-being. Notably, improvements in WASH have gained even greater prominence with the current fight against COVID-19. Now, for us to fully understand the relevance of WASH to health, it is important to understand the social determinants of health. Our health is determined by more than just our biological and medical factors. In fact, these make up only 20% and 30% of our health respectively. The other 50% of our health is determined by our physical, environmental, and socioeconomic factors. For this purpose, in 2019, the World Health Organization issued the social determinants of health. And these determinants include factors such as where we are born, grow, live, work, and age. Just an example, your salary may determine whether you have enough money to buy soap for hand washing, or where you live determines how easy it is to get to the hospital if you're sick. The systems that impact our health as individuals also affect entire communities. For example, access to healthcare in urban cities may be easier than in rural villages. There may be less places to buy materials, and there may be less or poor quality services. So when we talk of access to WASH, this may mean difficulties in having clean and safe drinking water, or sufficient water for hand washing, or even lack of sewer systems. These access inequalities can be systematic, with priority being given to certain groups of people or to certain sectors. So, although we are making progress in WASH access on a global scale, inequalities do exist, and these have been noted by the World Health Organization, and they have been grouped as residential, as socioeconomic, and individual. So while WASH access in rural areas, higher income nations, and among males is improving, the problem of access to WASH is not improving in the peri-urban, lower income nations and among women and girls. So let's talk about the peri-urban, and we commonly call it a slum. These are pictures of slums around the world. And the peri-urban can be defined as low-income, unplanned settlements with limited living space, high population density, and few municipal services, including those of WASH. As the peri-urban population increases, the WASH problem is also increasing. And sub-Saharan Africa has the fastest urban population growth at about 4.5% per year. And this is why our study is focused here. And this here is an image of the study site. This is where I come from, Lusaka, Zambia. And Zambia is a low middle income economy. It has about 18 plus million people. And the majority are under 25 years of age, so we're quite young. Lusaka is the capital city, and it is home to about 2 million people, similar to Sapporo. Now next to, or rather within Lusaka, you also have the peri-urban. You can see the contrast in the imagery. And 70% of the people that live in Lusaka actually live in places like this. There are 37 settlements of such type in Lusaka. When we go further to talk about wash and health in Zambia, 11.4% of all deaths in Zambia are related to wash. Nationally, we have about 67% of people having access to water, and for sanitation, about 40%. But this really reduces in the peri-urban, where you have as little as 44% and 10% having access to water and sanitation, respectively. More so, in the peri-urban, we have frequent cholera outbreaks, and this has been the case since the early 1990s. So exactly what is the problem here? Firstly, we know that diarrheal disease is treatable and preventable. But even so, we are having frequent peri-urban disease outbreaks related to wash. So our research question is, what factors maintain the peri-urban's poor wash ecosystem? In order for us to understand this, the main objective of our research was to analyze the peri-urban wash ecosystem through ecological theory. Now, ecological theory offers a means of understanding the relationship and interactions between an individual, his or her community, and wider society, subdividing behavior impacts into intra and interpersonal. So here you have your interpersonal or individual, which will deal with an individual's knowledge, attitudes, behaviors, skills, development history. Interpersonal level, which will deal with one's family, friends, peers, immediate environment. Organizational level, which focuses on the rules, regulations, and structures of schools, health centers, etc. Community, which deals with the norms and the values and how these organizations interact and function together. And finally, public policy, which is where we talk of the policies and laws that govern how we live within our communities. So through this theoretical analysis, we can identify peri-urban wash causal factors, maintainers, and key players for relative focused and impactful public health promotion and intervention. So these are the sites that were assessed for study sites. And we went through 3 in the beginning, but we decided to focus on site A and B. And I'll quickly go into our participants and methods. We conducted a photovoice study with 16 youth in our 2 peri-urban settlements in December 2017. Now, what is photovoice? Photovoice is pretty much taking a photo and telling the narrative, and groups tell the story of their lives and their communities. For the research method, we started by training participants on how to use camera and on ethics. This was followed by data collection, where participants took 2 to 5 photographs, and the photographs were meant to answer the framing question, what is WASH in your community? We then went through a process of contextualization, where the people who took the photographs shared the story of the photographs. They only shared of their best 2 pictures. They then went through a process of codifying what are the main themes or topics, and they used this to create posters, which they finally presented. All this information was then taken by myself as the researcher, and it went through theoretical thematic analysis. So what were the results? What is WASH in your community? In terms of photovoice, these are some of the samples. In the first picture, this was taken by a female, 22 years old, and she says, always keep your tap clean, not like this. And here she talked about the problem of poor practice in terms of management of water facilities. The second photo was taken by a young man, 20 years of age, and he said, it's not good to have this type of toilet. The toilet is not built, it does not have a roof, wall, door, and floor. It's dirty, and the toilet hole has no cover. There's also no hand washing station. And for this, he talked about the challenge of access to facilities and also the quality of facilities and people's knowledge of standards. Then this last picture I will give was taken again by another young man, aged 20, and he said the location of the dump site is not okay because the area is surrounded by houses. Children play near and at the dump site. Due to this scenario, people around the community get sick often. It's not safe for residents. And here again was the topic of lack of proper facilities, poor practice, and also being so close to areas of easy contamination or disease transmission. So in summary, under thematic analysis, our young people defined the peri-urban wash as poor practice, substandard and unregulated, a health hazard, but they did feel there was hope for change. And then these things were now placed into ecological theory. We had poor practice within the intrapersonal level, dealing with how individuals' attitudes or behaviors about wash were affecting the peri-urban environment. At the interpersonal level, that sometimes it was the actions of others that affected sanitation or the sanitary state of the environment. At the organizational level, that rules, regulations were not being followed, and sometimes there was also malpractice by organizations that were in charge of certain facilities. At the community level, that the norm of the environment had created such health hazards that had become common practice. And finally, that at the public policy level, the policies and laws and regulations were not reaching down and having an impact on the community. Of important note was that there was poor community engagement, which prevented this public policy from impacting all the other areas of the ecosystem. Our participants had a few WASH priorities and intervention areas that they highlighted. Firstly, they wanted more education on WASH and waste management, and they felt it was necessary to incentivize good practice. Secondly, they advocated for cleanups of their public spaces, improving their waste management, and they had several events towards this end. Thirdly, they really wanted more engagement with their WASH stakeholders and incorporation of residents in the various activities to improve WASH. And finally, that there should be more public-private partnerships and community-based organizations. Now to discuss, substandard and unregulated brings to light the theme of top-down approaches as it lies in policy and organizational levels. For the most part, creation of laws and guidelines is not done in collaboration with communities. Rules and guidelines are sometimes unavailable, and there are few avenues for reporting of malpractice. Relating to hope for change, it's important to note that in 1974, several peri-urban settlements, including my research sites, were upgraded to improvement areas, making them legal and placing them under government upgrade. Sadly, 47 years later, little progress has been made due to the cost of upgrading WASH. And there is a mismatch between guidelines for improved WASH and available and possible services in the peri-urban, making several planned interventions unattainable or unusable. Though recommended by several studies, local knowledge is barely explored and community priorities are often overlooked. This contributed to participant categorization of hope for change at inter and intrapersonal level. Community engagement has been recommended as a tool towards policy change to align local efforts, social frameworks, and increase community strengthening. So to conclude, really, what factors maintain peri-urban WASH? Poor community engagement, particularly with how it doesn't link from the individual to policy level, and the dependence on top-down approaches. There needs to be more WASH education, which includes local knowledge and priorities, as the communities are part of that hope for change, and it allows to decentralize accountability. And how do we intervene? through more public-private partnerships and community-based organizations. So we recommended Sikolanga as a community-based organization, which would start with inclusion of community identification, incorporating the marginalized, incorporating communities in data collection, and giving them the platform to share findings with their civic leaders to trigger solution building, and through organizations having one solidified voice. As we are talking about looking for the silver lining in the post-pandemic health sciences, of course, we are well aware that we have increased health disparities due to COVID-19. What does that mean for health scientists and researchers? That we should consider new ways of research with the use of technology, and that we should share our knowledge and empower others to share. But lastly, that in cases like my community where technology might not be easily accessible, we should go beyond and also engage through listening to incorporate local solutions. That is all for my presentation. Thank you very much.